and we're going to jump into the Q&A right now. I'm going to start at the top. Emily Peterson is asking, will patients like ML be able to be pain-free, or will he always battle some level of low-level pain? Just so we can help correctly set up expectations. I think that's for Peg. Is that your patient, Peg?
That is my ML. Well, we checked back with him a couple years later, and he is pain-free. I think that what I oftentimes tell people is I think some people are headache people, and some people are stomachache people, and some people are pelvic pain people, and that's kind of where their tension goes. And so I'm hoping that over time he'll be aware that maybe when he's stressed, he clutches his pelvic floor muscles, and that turns into that sort of spiral of symptoms and pain, and that maybe he can intercept it sooner rather than later, and be able to scroll it back. Does that answer your question?
I would have to ask Emily if that answered her question.
Yeah.
But staying on ML, Anonymous asks, for ML, what exercises were included in his home exercise program? Did you include internal exercises like anything analogous to using a trigger point wand or dilator in women? What frequency do you recommend for the home exercise program?
Great. I do recommend for some people a pelvic wand. I have we have a demo one, and we show people. There's some people who are really averse to doing it, and he was not averse. He was just like, anything, I'll do anything. And so, as I recall, he bought one, but didn't feel like he needed to use it. What he needed to do was to be aware of sitting position and standing position, and relearn some of his clutching of his pelvic floor. And he did do well, as I recall, with cat-cow, and being aware that when he did the kind of saggy cow, that his pelvic floor muscles were lengthened, and that when he went into the cat, he could feel them contract, and he could find his mid-range. I do an exercise with people that I call the 3 stations exercise, where once I know that they can use their pelvic floor appropriately, I'll ask them to just consider tensing their pelvic floor, letting it go, bulging it, and then letting it go, to just kind of find that rebound sweet spot, middle zone. And so I have people do that throughout the day, and breathing 5 good diaphragmatic breaths at least 3 times a day, sometimes before you get up from your meal and before you clear your dishes, to just take a moment to breathe, because it helps digestion also. And then what I like to do as far as their home program is to find out what they're choosing to do anyway, what he likes to do. Mostly he chose cardio things, and so I said, could we just include some cat-cow and some stretching as after your cardio exercise. But if people are going to do a bar class or a yoga class, or work out with resistance stuff or whatever, I'll try to just find something that will organically fit into what they do. And it was hard to sort of say in a generalized sense what I would have everybody do. Depends on what we need. He didn't need strengthening; he just needed stretching and awareness of how he was using his muscles in a kind of overdrive kind of way.
Thank you, Peg. Every time I hear you speak, I get more and more embarrassed by, the limited exercises that I teach my patients. That's just unbelievable, the amount of feedback and assistance that you can give those patients. I really appreciate you. And I think hopefully in the future, when we can actually meet together, maybe this is an opportunity to be able to show these exercises so people can have a visual to go along with the words, because I think that's really, really helpful, because I think that there's a lot that we can do, not to take over what you do, but to facilitate by getting them started before they come to you.
Absolutely.
All right, let's move on.
Absolutely.
Yeah, sorry.
Yeah, go ahead.
Emily Peterson now asks, for athletica pubalgia, when do you see a role for surgery? Well, that's interesting.
Well.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.